Pittsburgh's Action News 4.
Worldwide concern tonight, the Zika virus, already linked to serious birth defects. And now women being advised not to travel to certain countries, even told not to get pregnant while in those areas. So what does this mean for anyone who travels? And could this virus make it here to the U.S.? Pittsburgh's Action News 4 reporter Shannon Perrine takes those questions to the experts, all new on 4.
You probably don't need this week's snowfall to remind you that Pittsburgh is nowhere near Brazil. Rio's about 5,000 miles away from Pittsburgh. But we know two things. Brazil is dealing with a really scary mosquito-borne virus right now. And we also know the mosquitoes can travel. A tiny insect causing big concern. Brazil is the epicenter of an outbreak of Zika virus. 80% of those who get it have zero symptoms. The other 20%, it's still not a big deal most of the time.
Fevers, muscle aches, rash, and perhaps conjunctivitis, red eyes. Usually we resolve within a week.
But now, a potential link between pregnant women who have the virus and their babies born with microcephaly, a birth defect that causes their brain and head to be too small. We have seen the spread of West Nile virus to the United States. Mosquitoes can travel on individuals and on ships that go back and forth between countries. So, can Zika come here?
It is possible. There have been cases of returning travelers diagnosed with Zika virus, but no transmission events in the United States. Actually, Puerto Rico did have a transmission event recently reported. So, unfortunately, there is that potential that could get into our mosquito populations.
Dr. Como says if you are pregnant or could become pregnant and you travel to the danger zone, use insect repellent with DEET and take every precaution to avoid mosquito bites.
Wearing permethrin-treated clothing, which is a type of repellent, minimizing skin exposure.
Pregnant women who do show symptoms should see a high-risk pregnancy doctor, but know that if you have the virus, there is no cure.
Unfortunately, no preventative vaccines and no antiviral treatments available for this infection.
Dr. Como will be following any movement the virus makes, but once again, it is not yet here in the United States. Shannon Perrine, Pittsburgh's Action News 4.
For more on this story, head over to WTAE.com right now. We've posted the 5 things you need to know about the Zika virus. Just look for the story right on our homepage.